You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he said nobody should be wearing a loose-fitting denture. Permanent teeth with dental implants. With us, we have an expert on the topic. We've had him on the program before. He teaches other dentists this procedure, Dr. Burr Bakke. Dr. Bakke, welcome to the program.
Thanks, Randy. Thanks for having me back.
All right, now, we've had your wife on the show. You've been on the program before.
Absolutely.
She's big in cosmetics. Now, for people that don't know your practice, I mean, and specifically with dental implants, who's the typical patient that comes in for dental implants?
There's really no typical patient, so to speak. We have patients that are all over the map. Some person is missing maybe one tooth. We have people that are missing multiple teeth and they want them back. I mean, they don't want a bridge. They want to cut down two perfectly good teeth. They would rather have that tooth replaced with a dental implant. Then we have other patients that have been told their teeth are completely hopeless. They've gone through all the dentistry that dentistry can do for them, and they're about to lose all of their teeth. With those patients, we can give them fixed, permanent teeth same day. They can
So
walk
no more
out.
dentures is real today?
No more dentures is real.
Okay.
I started this process. My dad wore dentures, and it really got to me because he'd always send them to me broken or whatever, and say fix it, send it back, and things like that. And I decided back then that this needs to end. People don't need to be wearing dentures. There's too many bad things about them. They lose their taste and all this other things. There's sore spots, they break. That's why I went into doing this more. And
Now, are there a lot of people where you are that are wearing like an upper or lower denture?
Oh my gosh, I'm in Florida. We're in southern Florida. It's the retirement capital of the world, basically. There's thousands of people. I think I heard one time you could fill 2 or 3 football stadiums with all the people that need dentures just in Florida alone.
Is that right? Now, so if dental implants, getting your teeth back,
Right.
is such a good idea, why aren't they all doing it? What's your take?
I think my take is that they just don't know it's possible. You have a person that has dentures. They've worn dentures 20, 30 years, let's say, and they never go into the dentist. They don't have to. They don't need their teeth fixed. They don't have cavities anymore. Plus, you think about it, how'd they get to dentures? Most of them had a really bad dental history, dental career, if you might say. They had cavities, they had root canals, they broke teeth off, they were in a lot of pain. So when they're finished with that and they have dentures now, they think they don't have to ever go back in. So they really don't know. They don't go in, they don't research it until something happens. The ones I see the most are the patients that have a lower denture. They never stay in, they use 3 pounds of glue to hold it in, they get tired of it. Or their spouse has just recently passed away, they're on the dating scene, and you gotta admit, we're a very social society.
Yeah.
No matter what age we are, we wanna be out partying, seeing people, socializing. That keeps you going.
So if you're wearing a denture and you're dating, it's probably uncomfortable.
They're hiding.
Okay.
They're hiding. They're like,
Did they tell you this?
oh yeah, the other day I had a lady come in. My husband passed away. I have a lot of friends. I wanna go out. I can't go out to dinner with them. Every time I eat, my teeth fall out, something happens like this, I have to excuse myself, it's embarrassing. So what can you do for me? Can you really do this thing where you give me fixed teeth in a day? And it's absolutely true. I've been doing this same type of technology for over 14 years now, in different forms or fashions. And the way the new technologies have advanced because of computers and softwares and things like that is just amazing. We can do so much, so fast for people that's extremely accurate. And it's changing lives, absolutely changing lives.
Is it true though? I mean, they could walk in on the day of the procedure with no teeth and walk out the same day with teeth.
Absolutely.
That don't come in and out.
Absolutely, they're all fixed. They
Is that
go
every
in
once in a while that happens?
every time.
Really?
Every time. Now there's preliminary stuff, because I sit down with them. I was trained cosmetically. My original training was to become a cosmetic dentist. So I spent several years training for that. I taught it for a lot of years with my wife. That's actually how we met. When we met and got married, and I wanted to go back and do more surgery. She does better cosmetics than me anyway.
Okay.
So I always confer with her on the cosmetics. But one of your initial appointments with me, if we're going to do this, is to work on the cosmetics. Find out what it is you want, what it is that makes you happy, that will fix your smile. So when you walk out this door, you're like beaming from ear to ear, which they do.
Really?
And part of the cosmetic concept, or when I'm looking at this, I've got to design the fact that they're going to be smiling bigger than they ever have. So I got to adjust the teeth for that. But we go through that process. Once we get through that initial process and they come in the day that we're going to do the treatment, They walk out the same day with fixed teeth.
And how soon can they eat?
They can eat right away the same day. It's a softer diet, granted, because they still have to heal. But once they're healed, they're eating steak, they're eating corn on the cob again, teeth aren't moving.
I mean, can you bite like into like a carrot that's raw?
Absolutely.
Or vegetables?
Absolutely.
Really?
I have
So
a
you
lot
can eat
of,
whatever you want?
Whatever you want, within reason. I mean, whatever good natural food is, you can eat. Now, you're not eating bowling balls and rocks and things like that. I tell patients all the time that. But good, healthy foods, steaks, corn on the cob. Corn on the cob is a big one for denture wearers. They always ask me that question. Am I going to be able to eat me a piece of corn on the cob? You go, yes, sir, you can. Because their teeth don't move. They're fixed. They're permanent. They're in their heads. Works great.
Do you hear stories of eating stories when it's all done? And do they ever call you and say, are you sure I'm ready to eat food?
I had a man, this was literally about a month ago. He's been waiting his healing period. We put in his final porcelain, beautiful teeth. He goes, I'm going to go buy a steak. And that's the first thing I'm going to go get right now. I've been waiting for these months to do this. I paid for steak.
How old can you be to do this, to get dental implants?
Oh, as old as you want to be. There is no
what's your
limit.
oldest patient?
94.
Really? Why would a 94-year-old want to do this?
Again, it's social. They want to be able to go out and be social with people. They don't want to have to worry. There was an old joke used to go around back when we were in dental school and making dentures. You know, one set of dentures fits everybody in the nursing home. And it's true because they've lost all the bone. But now with fixed teeth, they don't need to. The last 10 years of your life, that's always kind of bothered me. People die sooner because they don't get out. They don't get to go out and see people. They don't get out and socialize. And that's key for us as human beings. We have to get out and socialize.
So there's a lot of people that can't eat in front of their friends.
Correct.
Because of their dentures.
Yes. They catch food up there. They got to go to the bathroom to fix them. The glue comes undone.
But I know a few denture wearers, at least a couple, they never complain.
No.
Are you saying there's no such thing as a happy denture wearer?
Not that I know of.
Okay.
I mean, why would they come tell you that they have dentures or they hate their dentures? You're their best friend.
No.
They're not going to tell you.
Okay, I'm not a dentist, yeah.
They're not going to smile at you either. They kind of either do this or whatever. They're not going to show their smiles most of the time. They just learn to adapt to it. And it's usually the lower one that brings them in first. And everyone that I do a lower one on, they come back literally within months and do the upper. Some I do both same time, which is actually better. But if they do the lower first, which is always the one they do first, and usually they'll send their wife in to do hers first. Men just want to wait. They come back later and do the upper too.
So, so the way dental implants are normally done is you go to one place, the surgeon that does the implant, then you go to another doctor that puts a teeth on top and maybe somewhere else for the imaging. You have it all right there.
Correct.
Is that right?
We do everything in our office. One of the great reasons that my wife and I kind of developed our practice this way was because of that. We kept hearing over and over from patients, I've got to go here for this. I got to go get my gum work done here. Then I have to go over here and get that implant put in. Then I have to go over here to have the crown screwed into place or whatever was going to happen. And I asked for the fee from this guy and he gave me his fee. Well, I thought it was for everything. Well, it ended up being 5 times as much because I forgot to ask for these other people. The beauty about our practice is everything's done right there. You have a world-renowned cosmetic dentist, my wife.
Yeah.
You have me, who does all the surgery and has been trained highly, highly, and very, very well by the best in the industry.
You've done thousands of these, right?
Thousands.
Does it cost more to go to a guy like you? I mean, because you've taught the process.
Absolutely not. The beautiful part about this is because we do it all in our place, it's all seamless in there, we don't have to charge more.
Okay.
We have our own lab. We have me doing the surgery. My wife helps on the cosmetics, but most of the time with these kinds of fixed cases, I'm doing the cosmetics on it. It's easy.
But isn't it true that if you've been wearing a denture, back to the denture wearers for a moment, like 20, 30 years, that you don't have enough bone to do this?
That's not necessarily true or correct.
Okay.
What I get a lot of is patients come to me and they have an old panoramic x-ray. A dentist says, they look at it and they say, no, you don't have enough bone. The beauty of our CAT scan is we can see your bones three-dimensionally. And with the new technology, it was designed over 20 years ago so that you don't need all the bone grafting. The implants are placed at angles and straight, depending on where you are. We can use less implants, all so that we don't have to do the bone grafting. I can't tell you the last time I've seen somebody that didn't have enough bone.
So you don't have to turn people away
No.
for that, even if they're in their 90s?
Even in their 90s. As long as they're healthy and they can get in my door, we can 99% of the time treat them. There's some we can't, but I couldn't tell you the last time we couldn't.
Okay, good.
Usually it's a health issue if that comes up.
All right, now you brought photos. What are
I
we
brought
looking at here?
photos. This is the first one. I love this lady. That's kind of her smile on the top there. It almost looks like a mugshot. And I love this lady, and I kid her about this every time I see her. That when she first came in, she wasn't going to smile. She looked like she was going to beat the tar out of me when I first met her. So we take that picture and we go through all of our process. We design all this, and we give her these beautiful teeth. And she walks out that day. And you can see by her after photos, she's smiling, she's vibrant, she's confident. It changed her. She literally walked in as she was going to mug you. She walks out as this beautiful, vibrant woman who's happy, healthy, just great.
So before, she had teeth that you couldn't save.
She had very few teeth. Mostly she had a lower denture and some sort of upper partial that was hardly even there. But you're correct, we couldn't say what was
So she didn't
left.
want dentures. That's why they come to you? Is that usually why they're saying, no way am I going to have a denture?
They either come to me because of that exactly. Somebody's told them that their teeth are hopeless and they need to come out for whatever reason, and they don't want dentures. And there's no reason to have dentures anyway. So they come to see me, they've heard about us, and this is what we give them: fixed permanent teeth.
Okay, and then she never has to look like that before again.
Never
You
again.
call it a mugshot. You tease her about that.
I tease her about it all the time.
And so it's
And
good.
I'll bring it up to her and say, here's your mugshot.
So they're back in the system. Like
Yes.
they're back getting their teeth cleaned and
Yes.
things like that. They
Yeah.
treat them like regular teeth.
We treat them like regular teeth. We clean them twice a year. We have a very specialized protocol that we do, that we've developed for keeping teeth clean that helps her maintain the implants.
Okay.
And we've seen it work over the last 10 years.
Okay.
And it keeps them really, really healthy. This guy came to see me after his sister brought him in. His sister was a patient of mine, talked to me about him, and wanted to help him correct himself. He had really kind of become a little bit of a hermit in his life. So she brings him in, we look at his smile, and obviously you can see from the before, he's missing teeth, there's gaps, everything's moved around. From his face, he doesn't look very happy. He's kind of smiling there, but it's like, you know, this is me. Back in Texas, we used to make fun of people in Arkansas. If they were missing a tooth, it showed their IQ. That's the way people look at other people. You're missing a couple of teeth, you're obviously not that smart.
Yeah, they are
And that's-
discriminated against, yeah.
And that's could be the furthest from the truth. In fact, I'm going to diverge a minute. One of my patients is a CEO of one of the biggest Fortune 500 companies out there. This man struggled with dentures his whole life. He came in to see me. We got him permanent fixed teeth. The day I gave them to him, I gave him the mirror. And this, I mean, the CEO of 500, you're going to think this guy's like, you know, I'm a big tough guy. Tears are streaming down his face. Tears are streaming down my face after I sit there with him. His wife comes in, she's crying. My whole office was crying when we're done. Changed his life. He was happy as he could be. No longer had to wear dentures or glue anymore. And he put up with that for years and said that. He said, you know, I've gone all this time and I didn't know I could do this. And I happened to see the show that you and I did before. And that's what brought him in.
And they came in. Now, this guy, and this
This guy's a
this
young
is
guy.
dramatic. And I could see where maybe people would judge him a little bit.
Oh, absolutely.
So he would have had to have dentures at that young age.
Yeah. Yeah, he was in his 30s.
So in one day, this is done in one day?
One day.
They had
One
a
day.
surgery, they walk out with teeth.
They walk out with fixed teeth.
Did they ever say that? Like, are you sure this could be done? Are you sure I could do this?
I get that all the time. I used to get it from some of the biggest names in dentistry because it was frowned upon back when it first
Because you were
came
one
out.
of the first guys doing this in one day.
I
Is
was
that
one
right?
of the first ones, yes, correct. In my area, absolutely. And they would say, you can't do that. It's not the tradition. Well, now there's over 20 years of research behind it, thousands upon thousands of cases behind this technology. So now more and more dentists are actually getting involved in this type of technology and doing this. Whether they do it themselves or they have a surgeon do it for them and they just deliver the appliance, or they're like me, and there's a few like me that actually do all of this in their office in one sitting.
Okay, now you do these guided. I guess it's lower downtime, more precise.
Correct.
You make surgical guides. And you do it on a computer.
Yeah, the beauty.
Why is that better than not doing it that way?
Couple reasons. The beauty of this is we use the CAT scan. CAT scans are virtually 100% accurate. Not quite, but virtually. We actually take and make models from the CAT scan. We do the surgery on that model. So make sure that the doctor does it guided. Again, like I said, we do the surgery once before we ever do it in the patient's mouth. So that makes it when we go to the patient's mouth, it's nice, it's routine, it's easy. That equates to less healing time, faster healing time, better healing overall, and with the use of PRP, LPRGF that we use now routinely.
Okay, good.
With
Good.
all
You
of
have
these.
time for some more photos.
Okay. This is a lovely lady that she came in, and that's actually a dentures on top. Basically yellow teeth. Not quite as yellow as in the photo.
So those are dentures up there.
Those are dentures on top. On the bottom, she had a partial denture. So she's missing most of her teeth. Last few on the bottom were hardly savable. So we take this woman, beautiful woman anyway. We make her the fixed teeth on top. If you look at her befores, narrow arch, you can see through the corners, all these black corridors down there, smaller teeth. She looks happy, but when you see the finals, you'll see how her face opens up again. It's not as closed down. So when we finish this beautiful woman, patient, we've totally given her fixed teeth on top, fixed permanent teeth that don't come out. We actually restored the lower also, doing the same thing, because the last few teeth she had on the bottom, they weren't going to make it very long anyway. She wanted everything done, so we do it all. So now she has this incredible smile. She's beaming now. She's confident now.
Because she's too young to be wearing dentures.
Oh, way
when I
too
look
young.
at this.
And every time she comes in, she hugs me, and I love that. It's great. She's a wonderful person.
Because they look like porcelain veneers.
They do. The nice thing about this case and the way we do all of these fixed cases is we end with a zirconia bridge work up there. Zirconia teeth.
Could they eat chewy things?
They can eat whatever they want as long as it's, I always tell them, you can eat good, healthy food.
Could you eat beef jerky?
You can eat beef jerky.
Really?
You can eat pizza. You can eat nuts, chips.
So it's like your own teeth. Whatever.
It's like your own teeth.
I mean, you could probably chew ice, but you don't recommend that.
You can chew ice, but I don't recommend it, correct.
Okay. So, and this is all done in one day?
It's all done in one day. You walk in with dentures or teeth that need to come out. We take the dentures out, we take the teeth out, we place the implants, we place the final healing appliances that day. You come back a couple months later, the zirconia porcelain.
Now we should mention this because we get emails about costs and things like that. Now
Right.
insurance, even great PPO or whatever insurance, doesn't cover this.
Correct.
Entirely. Medicare doesn't cover this.
Very little out there covers it, but the beauty is we have financing. We have multiple ways to help you make this affordable. Best of all, I have two beautiful women in my office. That's what they do. They sit down with you, they work through this to find a plan that will work with your budget and work for you, so you can have this
Are
done.
a lot of people financing this?
A lot of people are financing it. I mean, we have one financing plan that I know very little about the financing,
Okay.
except I do know one thing. We have a 12-month no interest. So
Okay.
they can make payments for 12 months. Doesn't cost them any more or any less. Nice way to do it. They don't have to come up with a chunk of money all up front.
So this, would you say this is the future of dentistry? Whether it's 20 years or 100
Absolutely.
years, nobody will be wearing these dentures?
If I could predict the future or if I could make the future happen, my goal is nobody ever wears another denture. I hate them. I had to put up with my dad with them. I don't want to see people have to put up with them. I mean, the funny thing that I always kid my patients about this when they come in with a denture and we do this for them. I say the greatest thing about these new fixed teeth you're going to have and the worst thing about these fixed teeth you're going to have is now when you eat a hot piece of pizza, instead of burning that plastic on the roof of your mouth, you're going to burn the roof of your mouth. And we
So
all
they have to
laugh
be
about it.
careful
So
a
they got to be a
little
little careful, yeah. But they can taste now. Their taste buds are not covered up by that plastic anymore. They get their taste back. They usually find I was putting like 10 pounds of salt on my food because I couldn't taste it. Now it's like, whoa, and they stopped with the salt. So they get everything back. They're smiling, they're happy, they can go out and be social, they can eat and
these are
drink with their
permanent
friends.
teeth? I mean, you could call them permanent teeth.
Fixed teeth. They don't come out. I can take them out.
Like a third set of teeth?
Absolutely.
Is that right?
Yeah,
okay,
absolutely.
time for a couple more photos.
Oh, this is a great man. I love this guy. He comes in to see me because he's having a little bit of pain. But when he walks in the door, his entire upper bridge comes out. His teeth had rotted out. So we talk a little bit, we show him what we can do, we decide to do it. So we actually replaced his upper teeth and his lower teeth. One day, gets fixed teeth. He's like a champion of our practice now.
Look at this guy. What do you
Yeah.
mean champion of the practice?
He's telling everybody. I got a patient the other day, one of his best friends was going to see somebody else. And he says, oh, no. And
Dr. Bakke.
He brought him in my office. And we just did his case yesterday before I left. So it was great.
Now, what about bad gums? Like, if they have bad gums, that's why they lost their teeth. Can they still get dental implants?
Most of the people I see, this is the reason for it. They come in with bad gums. They've been told that their gum disease is so bad, their teeth are hopeless. They need to have dentures made. It's not the case. You can come in, we can take out the teeth, we clean up the gums, we get rid of the infection, everything heals up beautifully. You get permanent teeth that go in the same day and don't come out.
Now you even have, and people need to know, I'm not trying to side with you, but you have like a lab or the technology to make the teeth right there.
Yes, we do.
While they wait.
My son is a lab technician. He's been to school, graduated top of his class. He's now in our office, and we have a lab set up, and he can take care of all that in our office.
Is that right?
Yep.
All the same day?
All the same day. This is a patient that came in to see me. The story on this guy is incredible.
Goodness. This has got to be unusual, though.
Absolutely not. I mean, how would you know? Those people don't smile. They walk around, they hide their smile. If they're chewing or eating, they chew like this or eat like this. They hold a book up, whatever it is, they're not going to smile at you. You don't ever see them. They've learned to adapt again. They don't want anybody to see their smiles.
That is somewhat common.
Very common.
Wow.
I see it almost every day. This gentleman, he spent his whole life working like crazy, giving everything to his family. He had 4 boys, he put them all through college. They had no debt coming out of college. He worked like crazy, didn't take care of himself. Finally, it's his turn. He comes in to see me. We take everything out. After all our planning, we give him fixed, permanent teeth, same day.
That's very nice.
Happy. I mean, he was already confident. I mean, he walked around with the other smile like that. He was confident in his business. He had a great business. But now he's happy. He feels better. The sickness that comes out of that really ravages the body, most people just adapt to it. And
the gum disease you're talking about.
The gum disease. It makes you sluggish. You just don't realize it. He came in 2 weeks later, he goes, I feel so much better. I have more energy. He was happy as he could be. He was taking his wife out dancing into dinner that night. So this before picture, look at that. See how bad they look? You can almost see the infection coming out of there. Can you imagine trying to eat with that?
So it hurts when they eat?
Oh, he said he was in so much pain he didn't hardly eat. The guy was literally a stick anyway. He didn't weigh anything, but he couldn't eat. It hurt. You can't chew your food. That's the other thing bad about dentures. Most patients with dentures, they have all these esophageal problems, stomach problems, GERD, things like that. They can't eat their food
because they can't chew.
They can't chew. It just kind of crushes it, and then they swallow it. And the body can't absorb it that way. With fixed permanent teeth, they're back to eating like they were 12 years old. They can eat whatever they want.
This guy's one day?
One day. One day. So somebody like this, with all this infection, we can take the teeth out, we clean out all the infection, place all the implants. He goes home with fixed teeth, same day. Beautiful smile, looks great. A couple months later, once he's healed, the porcelain goes in, he's even happier.
What's he eating? Do you know? Do you remember?
Yeah, he's the corn on the cob guy.
Okay.
He came in, he couldn't eat corn. I mean, look at his teeth. He couldn't eat corn on the cob with those teeth before. He owned a farm. He owned actually a big, huge business. And he had a farm. And he loved vegetables. He couldn't eat them. He was eating mush.
So now he's back.
Now he's back. He's happy. He brought me in a whole bunch of corn in actuality from his farm. So he was happy as he could be because of that.
So no more dentures.
No more dentures.
This is a guy that would have had dentures?
That's where he was heading. That's exactly where he was heading. I mean, you can look at those teeth, and any other dentist would have said, basically your teeth are hopeless. They need to come out, and you need to have put in dentures. Here's a real quick one that I want to just get in here real fast. How old does that guy look?
He looks like an older guy.
Yeah.
50s.
Yeah. So here's his story. A patient of mine that we did this procedure on brings him in. He's a security guard at this guy's, where he lives in his community. He was an ex-Marine. This other guy was an ex-Marine. They're buddies. Brings him in. He has no teeth in there. He can't wear dentures. They gag him so bad, he couldn't put them in his mouth. I could barely get an impression of his mouth because he was gagging so bad. We go through the process. We give him fixed teeth same day, and look at him. He's actually in his 20s.
Okay. Yeah, because you asked me at the beginning how old I thought he was. He does look younger, so teeth make you look younger.
Yeah, and now he's confident. So basically now, because of the fixed permanent teeth, he doesn't have to worry about dentures that gagged him. These don't gag him. They're fixed in there. They don't move.
How was he eating before with no teeth?
Mush.
Just nothing.
Basically mush. I mean, as best he could, but not much.
So now he just eats whatever
Now he can eat whatever he wants. He's happy. He told me, he stopped at McDonald's on the way to the office. He could scarf some burgers. I'm like, oh, please don't do that. But he did anyway. But he's doing well. He's great. Moving on with his life.
Okay, good.
Yeah.
So
So here's some
time for
other.
a couple more.
This gentleman came in, told the same thing. He needed his teeth all out, and happened to hear our story that we did with you, saw it on TV, came in, said, can you really do that? Can you do this in a day? Absolutely. Once we do our preliminary work, he came in, we took all the teeth out, we gave him the fixed permanent teeth. That day, he's never looked back. He looks different. He's just happier again.
Now, you said that they may even see you at a lecture or on TV.
Yes.
They come in and they're still skeptical. Like,
Oh, absolutely.
really?
We actually give community lectures once a month in our office. People come in. Are you sure you can do that? We've seen your ads, we've seen your stuff. You go, absolutely, I just showed you again. They see way more people than I'm showing you that we have in our lectures. Actually, once in a while, we'll have somebody there to say, yes, he can do this. He did it on me. But that's what happens. Nobody believes it.
Now, we are out of time.
Can I just show you the last two
Okay,
quick,
30
very fast,
seconds,
very fast.
30 seconds.
This lady came in, she'd been wearing a denture her whole life. Her bottom teeth were worn out. That's her after photo. She walked out with fixed, beautiful teeth same day. This lady, same way. Absolutely gorgeous smile. Happy.
And those are supported by dental implants?
Supported by dental
That
implants.
looks like cosmetic
fixed,
veneer
permanent
dentistry.
teeth. They look every bit as good as a natural
This is
tooth.
like dental clip art, like a model.
She looks beautiful, doesn't she? Nicest woman.
And she would have been wearing a denture.
Absolutely. Absolutely wearing a denture.
So nobody should be wearing dentures.
Nobody should be wearing dentures ever again.
All right, great. So, and by the way, we should mention we are out of time, but you don't like the snap in, snap out that's going on all over the place.
I used to do those, I don't know, 8 to 10 years ago.
Like dental implants, like to lock in your denture.
Right. It's nice if you want to wear a denture, you can snap it in. The problem with that is you still need glues. The old adage of putting in 2 little implants in the front and snap it in, they rock up and down. I had patients tell me this all the time. So you need at least 4 implants. The other problem is because they're taking them in and out all the time, it affects the implants. Eventually, you'll start losing the implants. I found about 4 or 5 years in. Plus, because of all of that, there's a lot more stress on that denture. They break more often. So you're always having to get a new one, get it fixed, get it repaired or whatever. Plus, why do that when for virtually the same cost as all of that, you can have fixed, permanent teeth that don't come in and out.
All right, good. I want to thank you. Always a pleasure to have you on the show. All these photos are on your website. Mm-hmm. You work as a team with your wife.
We do.
Your kids are now working in the practice.
Yes, they are.
3 of them,
Yes.
right?
Yes, all 3.
So that's good.
Yeah.
So thanks again. And
Thank you
if
so
somebody
much.
wants to have a consult with you, free consultation?
Yes. They call our office, and we do a complimentary consultation about, my wife does it for veneers, I do it for the fixed permanent teeth. We actually take a CAT scan, look at it together, and talk about it, because they always say, do I have enough bone? And I was told I didn't. So,
Okay, good.
yes, absolutely.
All right, great stuff. Thanks again.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.